Yeah, hi everyone. Welcome to my YouTube channel. My name is Dr. Wan. Today we're going to talk about typhoid fever. What is it exactly and how can it be treated? For transmission, that one I presume you already know that, but I can equally brief you people on the transmission. So typhoid fever, a bacteria infection caused by Salmonella typhi. Causes, we have Salmonella typhi and transmission, contaminated food and water, poor sanitation and hygiene. Now, I will take you back to the famous Mary Typhoid, which people must have heard. Mary Typhoid, to cut the long story short, was a cook who left Ireland to the United States, that's in New York, and was serving in a hotel. And the fact that Mary had typhoid in her system, she contaminated all the customers, and that's how it originated with the name Mary Typhoid, to cut a long story short. So, contaminated food and water can easily transmit the bacteria, just as poor sanitation and hygiene. Now we have risk factors: unsafe drinking water, poor hand hygiene, living and traveling in endemic area. So those are the risk factors. Now we have symptoms. So for the symptom, we have which usually appear 6 to 30 days after exposure. So note this very well. 6 to 30 days. That's when you start developing the symptoms. And the classical symptoms are high fever up to 104 degrees Celsius, degree Fahrenheit, or 40 degrees Celsius. Then you have weakness, you have fatigue, you have headache, stomach pain, loss of appetite, constipation or diarrhea. Then you have rose color spot on chest of the victim or the patient or on the abdomen. Then you have enlarged spleen or liver. Now we have treatment. For treatment, we have 3 medications currently used. That is cephaloxacin, azithromycin, and ceftriaxone. We will come back to this. Let's look at the diagnosis first. So for diagnosis, we have hydration and rest, and then hospitalization if severe, and prevention is drink safe, clean water, wash your hands regularly. Now, with regards to the treatment now, typhoid fever in adults is treated exclusively with antibiotics, the choice of which depends heavily on local antibiotic resistance patterns and the severity of the illness. Now, we have supportive care such as hydration and fever management, as is also crucial. Now, coming to primary antibiotic treatment, the WHO, or what we call World Health Organization, and other health bodies recommend a few key antibiotics, but the selection is guided by the likely source of infection. So we have fluoroquinolones, for example, ciprofloxacin, oxfloxacin. These may be first choice in areas with low levels of antibiotic resistance. In many regions, particularly South Asia and Sub-Saharan Africa, widely spread resistance has made them less effective. The next one is azithromycin. This is often the drug of choice for mild cases in areas where ciprofloxacin resistance is high, or for treating multi-drug resistance MDR strains. It has the added benefit of oral administration and a shorter course of treatment, typically 5 to 7 days. The next one is ceftriaxone, an injectable third-generation cephalosporin. Ceftriaxone is used for severe infections in hospitalized patients or when resistance to oral options is a concern. A typical course lasts 5 to 10 days. Now, other antibiotics like chloramphenicol, ampicillin, and trimethoprim sulfamethoxazole are generally no longer recommended as first-line treatment due to widespread resistance, but they may be used in specific cases where testing confirms the bacteria are susceptible. So this point is very important. Now, let's look at management of resistant strains. The emergence of extensively drug-resistant XDR strains, particularly in regions like Pakistan, poses a significant challenge. For these severe cases, carbapenem or meropenem are often used, which require intravenous administration and typically hospitalization. Important considerations: we have complete the full course. It is vital to take all prescribed antibiotics exactly as described, even if symptoms improve quickly, to ensure the infection is fully eradicated and to prevent the development of antibiotics resistance. The next one is supportive care. Maintain adequate hydration is important, as is proper nutrition. In severe cases, patients may require intravenous fluid, nutritional support, or even surgery for complications like intestinal perforation. Prevention, or call it prevent transmission. Individuals with typhoid fever must practice strict hygiene, especially hand washing, and should not prepare food for others until a healthcare provider confirms via stool culture that they are no longer carrier of the bacteria. So you see what I was just saying in the introductory part of Mary Typhoid, the lady who came all the way from Ireland and was able to infest so many customers who came to that hotel that night for food. So that's what I want to say. A healthcare provider should be consulted immediately for proper diagnosis and a tailored treatment plan based on individual health status and the local resistant pattern of Salmonella bacteria. So far, so good. My name is Dr. Wan. Please subscribe to my YouTube channel if you've not done so, and don't forget to share this video clip with colleagues as well as medical students, because typhoid is not a joke. Thank you and have a wonderful evening. Ciao, Dr. Wan.